Part B. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at question 25.
So, can I listen into the baby? Yeah, of course. And are you managing to do any exercise at all?
Not really.
No.
And I go for walks some evenings, but not every evening.
Well, walking's really good.
Yeah.
Yeah, you can practice on your back and your hands down. And how many weeks are you now?
32.
Just right. That's really good. So I'm just going to feel round. Tommy, did they do this at the hospital?
No.
No. Okay, so I feel the biggest part of the baby is the head. You start feeling for the head or the bottom. The hardest parts are the bottom and the head.
Okay.
And then with my hands doing this gently, the baby's being moved in the fluid.
Yeah.
And I can feel, just go soft, sink into the, you're comfortable?
Yeah.
It's not easy with a camera on you, is it? And I can just feel the back of the baby, which is over on this side.
Okay.
And then this might, because I'm pressing down, so take a breath in. And as I press down, it might be a little bit uncomfortable, you breathe out, go. Oh, very good. And we'll do that again. And then breathe out. Okay, so the head's down, that's the bottom then we're feeling here. This bit here, because the widest part is down there, and there's plenty of space.
Yeah.
Question 26. Now, read the question.
You know, nurses often play an integral role in all of our lives. They're the comforters and caregivers in the best and worst of times. And this week is National Nurses Week, by the way. And Perry has a very touching story of a nurse and her patient.
Yeah, well, Nicole Leroy has lived this story for the last year and a half, but it's just now being told. A stop inside the Little Clinic in the Hyde Park Kroger during her lunch hour one afternoon and a chance meeting with the nurse working that day may have saved her life. This is a journey Nicole Leroy has been waiting a year and a half to take, back to see her nurse at the Little Clinic.
Hi.
Oh. How are you?
Good. I just want to thank you.
Jessica Smith, a family nurse practitioner at the Little Clinic, listened to Nicole, something several doctors hadn't done.
You researched, you looked in your book, you tried to figure out what it could be. And a month later, I found out that I had cancer.
Cancer, stage 2 Hodgkin's lymphoma.
I'm 36 years old. I'm in the best shape of my life. You don't think it could happen to you.
A diagnosis a year in the making.
I've been to a gynecologist, a dermatologist, primary care twice. And each one of them told me that I was either just virus clogs in my lymph nodes, or that I was self-inflicting, or that I had depression, I had anxiety.
But Jessica thought it could be serious, so she encouraged Nicole to keep fighting.
She looked me in the eye and she said, you need to go follow up further. You need to go see your doctor again. You need to push.
Question 27. Now, read the question.
Internal medicine. So you as a doctor may be seeing dozens of patients in a single day. How will a system like this affect your day?
Well, I'm an emergency physician, so I work in an area where there's patients in rooms all around me. They all have questions. I can't tell you the number of times a day I see a patient limp out of a room and they want to know when lunch is coming. If we could get them the answers without them having to come out and search for someone to answer the question, it's a win for everybody.
Question 28. Now, read the question.
These devices are incredibly simple. There's just two buttons on it that you need to know about. The first one is the green one which says on and off, and that's the first step. Stage 1, turn it on.
Call emergency medical services now.
It tells you exactly what to do.
Remove all clothing from chest and stomach. Peel off the pad labelled 1.
Now we've got the pads on the patient's chest. The next thing is the device will analyse the rhythm and recommend a shock if appropriate.
Patient. Shock advised. Stand clear.
It's asking me to press the button to give the shock.
Shock delivered.
So that's the shock delivered. Now what will happen is that you'll carry on doing CPR if appropriate, and the machine will go into a cycle then when it reanalyses and gives further shocks if need be. But all you need to do is just listen to what it's telling you.
Begin CPR now.
And this one's even got a little button that if you press it, it'll give a sound prompt so you can get your CPR at exactly the right rate. Trust me, if I can work one, so can you.
Question 29. Now, read the question.
Excuse me, I'm a little chilly. Can I have that blanket, please?
What? What do you mean?
The blanket, I'm a little cold.
Did we do surgery on your arms?
Excuse me?
Did we do surgery on your arms?
No, but I'm in a lot of pain.
I want to see you go grab that blanket and pull it up. There is no reason why you can't pull that blanket up.
I have a lot of back pain, though. Can I have some medication?
Well, you're supposed to be in pain. You had surgery, so you're going to be in some pain. Hold on a minute.
I have a lot of pain, though, ma'am.
Okay, I'll be in a little bit.
Question 30. Now, read the question.
My name's Phil. I'm an instructor, and Holly's a student working with me. We're going to be taking care of you today. Would it be okay if we ask you a few questions?
Yeah, that was fine.
Okay.
I'm just going to verify your first and last name. If you could tell me your first name for me.
It's Lori.
All right, and last name?
Smith.
All right, and your birthday?
August 1st of 1974.
All right, and Lori, what do you prefer to be called?
You can just call me Lori.
All right, it's nice to meet you.
Thank you. Yes, nice to meet you. So Lori was admitted last night with an asthma exacerbation.
Okay.
During the night, you had a couple of breathing treatments, correct?
Yes.
Okay. You feeling better since the breathing treatment?
Yeah.
Okay. They also gave her some prednisone as well during the night.
Okay.
So the plan hopefully is to have you discharged later today if you continue to feel better.
Okay.
Do you have any questions for us so far?
Am I getting any more treatments before I leave?
So they have another treatment scheduled in about an hour for you.
Okay.
If things get worse before then, you can give us a call and we'll certainly be back in and we can reassess the situation then.
Okay.
Would you mind if we listen to your lungs at all?
No, go ahead. It's fine.
How's your breathing right now?
It's better than it was.
Okay. Any pain at all anywhere?
No.
Okay. I'm just going to go ahead and take a listen here. You could take some nice deep breaths for me, okay?